Good afternoon. It's Tuesday, March the 9th, 2021. Sagal, David Lahashu Juts, and welcome to today's edition of the COVID-19 Task Force Update on this, our 187th edition of Kahnawake 911. We're going to have a little bit of a busy show for you, lots of updates and information, and we're going to start off with our guest, Zachary, Peacekeeper Public Relations Officer, followed by Westaway of the KMHC, and last but not least, Lloyd Phillips, Commissioner of Public Safety. And we'll start off the show with Kyle. Mr. Zachary.
Thank you, Dave. I will be brief today. I am here to speak to you, to remind you about the directive surrounding Directive 58. Just to remind you, Directive 58 says that anyone crossing the border for longer than 24 hours for work or educational reasons has to self-isolate for the 14 days. And you can be exempt from isolation with proof of a negative PCR test, lab test, within the previous 24 hours. Or if you receive a weekly PCR and are negative, we have to point out that the onus is on you to show the proof to the agent at the border. So whatever proof you have, it's on you to bring it there to show that you do, this exemption does apply to you. So the Peacekeepers, we receive daily updates from the Canadian Border Services Agency, and we do follow up on them on the reg to just ensure that everybody is following these directives that are put into place. A bit of a happy announcement. On March 4th, members of the Kahnawake Peacekeepers were fortunate to receive our COVID-19 vaccinations. We received the Pfizer vaccination. Not every member of the Peacekeepers was vaccinated. However, I'm really proud to report that 98% of us did receive our COVID-19 vaccinations, and it's the first step into ensuring that the Peacekeepers continue to serve this community and to ensure the health and safety of all of our clients that we represent. We've seen an increase in calls for assistance for mental health reasons, and we just want to cover this subject again. We realize the 1-year anniversary of the pandemic is quickly approaching in a couple of days, in fact. And that anniversary coming up is impacting a lot of people in a negative way mentally. And I want to be sure that you know, watching this, that your mental health, it's crucial. It's so important to start at the top, take care of yourself in your mind, and your body will follow. So if you find yourself experiencing a crisis, a mental health crisis, you can call us. You can call the Peacekeepers directly, 450-632-6505, and we can put you in touch with a professional who can help you if you're feeling the need just to talk, to get some things off your chest. And at the same time, we can look forward to brighter days. We're approaching 5 o'clock, and it's a beautiful sunny day still, where a couple of months ago it would have been dark by now, and we're turning a corner here. We're seeing the days are becoming longer, the weather's becoming warmer. There's a light at the end of the tunnel. The community is starting to receive its vaccinations. But again, if you need help, if you need any kind of mental health checkup during regular office hours, Monday to Friday, 8:30 to 4:30, you can call KSCS directly, 450-632-6880, or if in the off times, anytime after that, you can call us and we can put you in touch with an after-hours response worker. So take care of yourselves, take care of your mental health, and that'll be it for me today. Thank you for having me. Go.
Kyle. And just a little bit of information for clarity purposes. If you are crossing the border to come back to Kahnawake, get your test, or even to visit, you must have that PCR test 72 hours before you cross. So you have to have that period of 72 hours in order for it to be valid. Thanks. Up next, we have Westaway from the KMHC. Lisa?
Thank you. So I'd like to provide an update on where we're at with vaccinations. So we're just going to pull up our daily thermometer, which gives us information about number of people who have been vaccinated. Well, I'm waiting for that. Oh, here we go. So we actually have vaccinated, it's like a drum roll, I feel that way today. Anyways, we've actually vaccinated 15% of the community. So quite a large number of people have already been vaccinated. And I can't see the total from here. I think it's 943 of 6,353 people who are 18 and over. So as you know, right now we have Moderna vaccine at the bingo hall, and we will have Moderna for the remainder of the vaccination campaign, and therefore it is 18 and up, and we're at 15% of the community. So this is really great news. We're vaccinating right now just under 300 people per day, and we will continue to do that until we've reached our goal. And just to give a little bit of an update regarding how things are going at the vaccination site. So last week we had a more vulnerable population, so we had more time in between vaccines. We've reduced the time a little bit today. We've increased the number of nurses, and still, despite the fact that we had many more people being vaccinated, it was a really smooth flow. Everything went well, and from the remarks and comments from people that I had spoken to, they were really pleased with the process. So we're really, really grateful to the excellent collaboration between Longhouse, MCK, KMHC, many different people who are participating in ensuring that the vaccination process is a success. And it's really, really nice. Oh, there's also KFB, I can't forget. It's actually just a really nice collaboration where all of the community is working together, and it's a positive environment. So if for nothing else, people are coming also to be vaccinated so that they can socialize in that 15 or 30-minute waiting period after their vaccine. So that's going really well, and we thank everybody for their collaboration and their patience. And there was a little glitch this morning that I'll talk about, and that was with our booking procedure online. It has been fixed, but there was a provincial reset to the actual online software that blocked anybody who was under 75 from booking an appointment. Unfortunately, that encompassed our region, but as we know, we're booking everybody right now, all ages 18 plus, and that really is the case here in Kahnawake. However, that's not the case elsewhere, and therefore there was a little glitch in the process, but that's been that's fixed now, so you can definitely book online, and it is the easiest way to book. So we do have 2 people answering phones at KMHC. If you need to call, 450-638-3930, and the extension is 2295 or 2206. You can leave a message. We are calling people back. As you can imagine, it was a little bit chaotic this morning, but we are getting through the callbacks so that you can get your appointment. But not to worry if you haven't gotten through. There are still plenty more vaccines and enough available for everybody who's interested. So just a reminder that the hours of operation at the vaccination site at the bingo hall are Tuesday to Saturday. All days we're vaccinating from 9 to 5, except for Wednesdays where we're vaccinating 10 to 6. And this is just to give a little bit more flexibility for those who are working. However, we urge you to make the request to your employer if necessary to allow you some time to be vaccinated. The whole process doesn't take more than an hour, and that's the max really from what we've seen over the last 4 days. So we really urge you to book your appointment, not to wait to the end. And if you're booking online, you may not see days available for the next 3 weeks. You may only see a couple of days at a time, and that's because we really want to fill our maximum amount of spots per day. So we're booking sometimes 270, 280, 300 appointments per day, depending on the number of nurses we have available. And so we'll only allow booking of a certain amount of days, and once they're full, then we open up further days. So I want to just give a little bit of information also about a release that we put out today for students or cross-border workers who may have a little bit of difficulty getting appointments at the vaccination site, because when you do come back to Kahnawake, you should be in isolation if you don't have negative PCR test or if you aren't exempt from isolating. And so obviously if you're supposed to be in isolation, you shouldn't be at the vaccination site getting vaccinated with the rest of the community. So what we've done is we're putting in place a process so that people who are in isolation can still be vaccinated. And before we can finalize this process, we need to know how many people we're dealing with here, how many people actually need special consideration for vaccination because they should be in isolation. So what we're asking is that if you fit this description, if you're in this situation or scenario, that you contact public health at 450-632-0635, and you just need to leave your name and phone number. And once and if you can do that before next Tuesday, I think that's the 14th of March, then we will finalize the procedure. We'll call you back and we'll give you all the information you need so that you can be vaccinated here in the community. We are also in the process of finalizing a procedure to vaccinate any individual who is part of the adult day program. And so we'll be getting in touch with families who are in this situation very shortly as well, so that we can provide you with a time for vaccination that might be a little bit easier for your loved ones. Lastly, medical transport is definitely assisting people who don't have a means of transportation to get to the vaccination site, and therefore we have communicated in various ways that you can contact medical transport to assist you with transportation to the vaccination site if you need it. Testing. So the testing site is still open. So although we're talking about vaccination, we still have people with symptoms who require testing. So we continue to urge you, if you have COVID-related symptoms, to call the testing site and be tested. We presently have 0 active cases. However, we do know that there are cases that, although total number of cases, hospitalizations, and death are decreasing across the province, we do see an increase in cases related to variants which spread more quickly. So it's really important that we identify positive cases as quickly as possible so that we can isolate. And so we still need to keep in mind that the virus is still amongst us, and we need to maintain measures, even though we're starting to feel like spring and get this urge to be out and about and socialize, and we're getting vaccinated, all very positive things. However, we still need to maintain measures of distance, hygiene, and masks. And the task force is going to be looking at modifications to measures in the coming weeks. However, we still have a few weeks where we need to maintain these measures. And of course, we still need to wait for the second dose before we are at that higher level of efficacy with respect to protection from the virus. So when we talk about second doses, we can give you some information about that right now. So anybody who's coming in to be vaccinated is receiving their second appointment for their second dose at approximately 112 days. So that's about 4 months. And that right now is the Quebec recommendation. It's the recommendation from the Programme d'Immunisation du Québec, the PIC program, which you can see online if you're interested. And so we are booking those second doses when you come in for your first dose. And we're looking at the possibility of finalizing that as well, appointment dates and times for residents both at KMHC, Elders Lodge, and ILC. So we'll be giving you more information about that shortly. I think that's it for me. Just a reminder that Moderna vaccine is really 18 and over. So even if you're a few weeks shy of your 18th birthday, you cannot book your appointment during our vaccine time unless you are actually 18. And the system may allow you to book it, but we would have to cancel your appointment prior to being vaccinated, unfortunately, as those are the recommendations from Moderna. We're trying to work out getting more Pfizer vaccine for 16 and 17-year-olds closer to the end of the vaccination campaign. But again, we'll keep you posted about that as we move forward as well. And if you need assistance in using the Click Santé, the website for online booking, which again is the fastest and easiest method to book your appointment, then the communications team here has done a wonderful video with KMHC, and it's online at Kahnawake 911, I believe, which is where the link is to be able to book your appointment. So feel free to look at that. It has a lot of useful information. Just a reminder that Dr. Gauthier's frequently asked question document about vaccinations has been updated. It's also on the Kahnawake 911 vaccination site, and I urge you to take a look at that, because many questions that we receive on a day-to-day basis about variants, about allergies, about restrictions, all those interesting questions about vaccination, you have real, genuine, transparent answers on the website on that document, which is being updated on a regular basis. So please take a look. Thank you.
Yeah, well, Lisa, and once again, if you are an iron worker or somebody who's working over the border, or somebody, if you're a student studying over the border and want to come back to get your vaccine, please remember that it's a special registration period, so you have to call the Public Safety Unit, and that's at 450-632-0635. And now, coming up, Lloyd Phillips. Lloyd.
Thank you very much, Kyle. Thank you, Lisa, for that information, and certainly I'm sure the community is glad to hear that the vaccine is certainly rolling out in a timely manner. You know, with this a few minutes ago, we did the math and looked at approximately 15% of the community has already been vaccinated. Tremendous news, very positive news for our community, and obviously we'll be reporting on those numbers regularly, and obviously hoping to reach our goal by the end of the month of 80% plus of the community to be vaccinated. So very positive news. I'm very happy to be standing here to give good news to the community. And as you know, we've been through some rough times, and I had to stand up here in front of the community and deliver some bad news, some negative messages and such, and impose restrictions, over the past year. But I'm certainly glad we're at a point now where we're talking about vaccinations. We're talking about revisiting directives in the coming weeks, and looking at what can be modified in terms of directives, what can be modified in terms of measures. That's something, a discussion that will happen in the coming few weeks. But as I mentioned on last episode and on K103 as well, right now we want to focus our energies on getting the community vaccinated. We want to reinforce to the community that we must remain vigilant. As Lisa had mentioned, there is still the virus around us. There still is the variants that are around us that we have to protect ourselves from. And even though somebody has been vaccinated, it does take time to build that level of immunity. And before you're considered to be fully vaccinated, you need to receive both doses. So we even though there's positive news, we're moving very rapidly in a positive direction. We must remain vigilant and remain on track to keep our community safe. 0 positive cases in the community for the past week or so. Again, more tremendous news. Great effort from everybody involved, including the community members. But again, just because we're hearing 0 active cases, that doesn't mean that that should let us the opportunity to relax. It's our time to keep our foot on the gas, and as the finish line is approaching. So we have to remind people that we must remain vigilant. Things are happening at a rapid pace. There's new information coming out daily. As Lisa outlined, there was a few glitches, in the booking process this morning, and we understand, community members want to book their appointments, and that's great. Things are up and running again. Keeping in mind, there are hundreds of moving parts, to this whole vaccination process, so yeah, we're bound to run into a few glitches here and there as things move on. But for the most part, things have been moving very smoothly. So we certainly keep encouraging people to go online, book your appointments, and once the days are full, we will open more days, as Lisa mentioned, so that we can have as many people booked at the same time for the same days. Because we want to fill up those time slots, because there are many people who are working at the vaccination center. So we, if we have the ability of doing 300 people a day, we want to make sure that we have the maximum number every day booked, so that we're utilizing our resources properly, but also get our community vaccinated, as quickly as we possibly can. So again, Kahnawake911.com, log on there /vaccine. You have the link there for the click Santé to be able to book your appointment, and it's a fairly straightforward and easy process. But again, if you need to, there's always phone numbers to call. With that, I'll end it there very shortly. I think a lot of information has been passed on already. I'm just here to, again, congratulate everybody who's involved in the process. Great collaboration, great work from the community, and keep up the good work, and we'll talk to you soon. Onigawahi.
Nyawa, Lloyd. And just before we go, just another reminder to get those the information out to you. Kahnawake911.com to book online, which is the easiest way for you to do it right now to get your vaccine. And if you're having issues or problems, you can always call KMHC at 638-3930, extension 2295 or 2206. And just before we go, just like to remind you that we do have testimonials playing right after our shows. And today we'll be hearing from Peacekeeper John D. Delormier about his vaccine. And that's it for today's update. Thank you very much for joining us here today. From all of us, Nyawagoa, Danu, Onigiwahi.
Diak getting the first shot of the Pfizer vaccine. Brigitte, she is administering the vaccine today. Everybody seems to be in good spirits, and I'm quite excited.